just a second as we let everyone connect to their audio. All right. Thank you, everyone, for joining. Welcome to the best practices for reopening, preparing for yellow tier. Today's session is hosted by the Office of Economic and Workforce Development and produced by the virtual outreach team of the COVID Command Center. Special note, San Francisco, yes. Some housekeeping for today. Language interpretation is available in Cantonese and Spanish. To enable language interpretation, click the interpretation icon and choose the language channel that corresponds to your needs. Recording. Today's event is being recorded and streamed live on Facebook and YouTube. We do respect all participants in this convening today and want to create a safe space for all. By default, all participants will be muted and video is disabled. Video will be on for speakers only. For chat, to participate in the chat, please select the chat button at the bottom of your screen and send any questions to Q&A Catherine Daniel. Get tested, San Francisco. You can save lives and stop the spread of COVID-19 by getting tested through your healthcare provider. If you have symptoms or have been exposed to COVID-19 but don't have health insurance or can't get tested through your provider, visit sf.gov/gettestedSF or call 311 for information on getting tested at a city-run testing location. A safe and effective COVID-19 vaccine, coupled with continuous preventative measures, are our best tools to end the COVID-19 pandemic and safely reopen San Francisco. Vaccines are free for those who live or work in San Francisco. Go to sf.gov/COVID vaccine for information on eligibility, vaccination sites, including locations, and links to book an appointment if available. Now is the time to come together, San Francisco. Together, we can stop anti-Asian discrimination, bias, hate, and violence. The COVID-19 virus has no race or nationality. It is simply a disease. To report a hate crime, please call San Francisco Police Department at 415-553-1133. In the event of an immediate emergency, please call 911. A quick special note for any press attending this call. If you have any questions that are regarding items outside the scope of this event, please send your inquiries or comments to dempress@sfgov.org. We'd like to offer this space to businesses and organizations at this time. And here's our agenda for today. Now I'd like to hand the floor over to the Acting Director of the Office of Economic and Workforce Development, Ann Topier. Ann, the floor is yours. Ann, just want to make sure. There we go.
I was locked out there for a second, but thank you, Elisa and Nick and the entire virtual outreach team for once again producing our reopening webinars, and also to everyone who has called in to join us today. I'm Ann Topier, the Acting Director of the Office of Economic and Workforce Development. We are pleased to host today's webinar, which is now our third opportunity to partner with the Department of Public Health to provide you with the city's latest updates on reopening. Unlike the last two webinars, which we held to offer notice about what will reopen in advance of a pending tier change, we are currently a bit less sure of when we may be able to move into the next tier. As Dr. Phillip will explain in more detail, we may need to wait for a bit longer before we meet the state's criteria to advance into yellow. Additionally, late last week, the state issued new guidance around indoor live performances, events, and meetings effective April 15th. As a result, Dr. Phillip and her team have been analyzing the state guidance and making decisions about how San Francisco will go forward with regards to these and some additional activities within the orange tier. Next week, we will update our health order to reflect these expanded activities. Because of these changes and the fact that we don't have a good sense of when we might be able to move into yellow and what our context will be at that time, today's webinar is mostly focused on the activities opening next week while we are still in orange. That said, and in keeping with our objective for giving the business community as much notice as possible about what's coming, we do have some sense at this point of what could reopen and how and when we get to yellow, and we will share the information that we have and allow you all to do the work you need to do in order to prepare to reopen safely with a sense of what will be allowed. Our cases are still low, but with more activities and more movement within our communities, the decline that we've seen in previous weeks is flattening. This week, we reached the milestone of giving the first dose of vaccine to more than 50% of eligible San Franciscans. But we still need to get more people vaccinated before we can feel confident that the risk of another surge has been fully mitigated. We also heard from the governor this week that if we are able to continue along our current path of widespread vaccinations and stable, low hospitalizations, that by mid-June, we could pursue a full reopening. What all of this means is that we can see very clearly a path to the place that we've all been waiting for over this long last year, a point in time where life could resume with some degree of normalcy and business could operate in a stable context. To get there, we continue to need the work, creativity, and partnership that our business community has shown throughout the last year. Let these next few months be one last push at ensuring that we do everything we can to contain the spread of the virus so that we can meet the criteria we need in order to move forward into a new phase. Thank you for your commitment to following the health orders, operating safely, and doing your utmost to protect the health of your employees and your customers. That will get us to yellow, and it will get us beyond if we can keep it up for just a little while longer. What we have seen over the last year proves that our business community can come together to respond. You have done it, and we want to support you with what you need to continue to do so in the way of information, tools, grants, and loans, and any assistance that we can make available. As always, I want to highlight our website, OEWD.org, where you can find all of the most recent information about reopening and what is and is not allowed. You can also find information and links to resources and such as grants, loans, supported programs for businesses, workers, and nonprofits. We have listed resources available to you at the local, state, and federal level. Please check it out. If you have questions about any of the information we have included, you can reach out to our small business and worker hotlines, where you can speak to a real person and get personalized assistance. With that, I will turn things over to the topic of today's webinar. Dr. Susan Phillip, the city's health officer, will speak to our health indicators, our vaccination progress, and the activities that we expect to reopen under the yellow tier. We will also hear from Maggie Weiland, who leads the Community Education Response Team, known as CERT, about the role CERT is in regards to open activities. Then we will hear from Patrick Fosdal from the Environmental Health Branch of the Department of Public Health to explain the city's enforcement of health regulations. After the presentations, we will have time for Q&A. Please send your questions through chat to Q&A for them to be answered live. Please note that because this is a preview to reopening, we may still not have all of the decision made, and it is always possible that things might change with regards to either our health indicators or the rules that guide us between now and then. We do our best to give you as much information as possible so you can plan accordingly, and we will be transparent about what we are still deciding. But as the city moves into a new tier of reopening, you will need to check the health order to confirm the rules that guide your sector. With that, I want to hand things over to Dr. Phillip to walk us through where we are now and what to expect next week, and finally touch on what reopening looks like once we do move into the yellow tier. Thank you, Dr. Phillip.
Thank you so much, Director Topier, to you and to all of your team at OEWD for being such great partners in this work. And thank you to my city colleagues and the virtual outreach team for, again, bringing us all together for these discussions. So I'm so happy to be with you again and talking with you. We had thought that this would be a session on preparing for yellow tier. But instead, we're going to talk about the current situation, where we are, and then what the state has recently announced and what we will be doing in response for that. So next slide, please. And thank you for the help with the slides. So as we have heard, San Francisco is not moving to the yellow tier next week as initially anticipated. We did not meet the criteria. Our case rate remains too high. We are staying in the orange tier for a bit more. It's unclear when we will advance to the yellow tier because our case rate is not declining as it once was. However, as you all know, San Francisco has been not expanded fully to the extent of orange tier as allowed by the state. And we've done that to cautiously expand the numbers of services and sectors and capacity, because the goal that we have had is to continue moving forward continuously and not have to move backwards because we have opened too quickly. The virus is still with us, as we have just heard from Director Topier. We'll talk through some of the epidemiology, but it is important to remember that we are not at the point, although we can see the finish line, as she said, we are not at the point where the virus is done with us yet. And so caution is still warranted. We are now going to be following the state guidelines in large part for indoor live events, performances, and meetings, as well as gatherings. But again, with some local modifications, recognizing that San Francisco is a very, very dense city, that we still have vulnerable populations who have not been vaccinated, and that we need to proceed again with caution at this point. The changes will go into effect on April 15th. But again, these are dependent on cases and hospitalizations staying stable throughout. We need to remain cautious. As I said, COVID-19 is still with us. We continue to be concerned and are monitoring for variants. But we know that the vaccinations are very robust, and that will be our ticket out of the pandemic. We have not been able to receive as much supply of vaccine from the federal government as we would like because of supply issues nationwide. We anticipate that will increase, but again, it leaves us in an interim period where we still haven't vaccinated as many people as we would need in order to open everything safely. And we also know the ways in which we can continue masking, distancing, and following the health orders and guidance in order to do what we can do safely. It's always possible that changes to what I'm going to talk about today, as every time we come together like this, might change between now and Wednesday, but I want to give you a sense of how we are thinking about expanding in the orange tier and incorporating the recent state guidance. Next slide, please. But first, again, I want to show you the data behind some of the context that I just mentioned. In San Francisco, over the past few days, our cases are beginning to crawl up. We had seen a really amazing and great decline in cases from our high in early December during that terrible third surge that we experienced and was experiencing all over the state and the country. But in recent days, as you can see at the very end of that curve, we're creeping up again. And again, we're nowhere near as high as we were in any of our first three surges, but it is a reason to be cautious and to really keep an eye on this. Next slide, please. And just as the cases are lower than they have been before, Our hospitalizations have also been much lower than they have been during our past 3 surges. And although those also have increased slightly in the past few days. And this, as you can remember, has been one of our main points of focus. We want to make sure that our hospital capacity remains good. And because hospitalizations lag by several weeks, by the time these start to increase to a point where it's concerning, it's likely too late to prevent a surge or a swell of cases, whatever you would like to call it. And again, this is going to be a measure that we watch and continue to watch closely. Next slide, please. So we've talked a little bit about the sobering news, the things that we are moving forward despite seeing. And we believe that we can do that cautiously because the new variable that was not here during the past 3 surges is vaccine. And again, this is going to be our ticket out of the pandemic. We've been doing a great job in San Francisco, and we thank all of you so much who are eligible for vaccine at this point and have gotten it or have encouraged your staff or employees to get it. In some cases, your customers or clients who are eligible. And what we have heard from the governor is that on April 15th, vaccine will be eligible to everyone age 16 and up in the state of California, and we will do that as well in San Francisco. So remember that the vaccines are authorized by the federal government, by the Food and Drug Administration, only for people who are 16 and up. So essentially what it's saying is that anyone who is authorized, who is able under our current emergency use authorizations for any of the vaccines can get it starting April 15th. So that is great news. And when we have vaccines, San Francisco has done a great job of getting people vaccinated. So just this week, we passed the milestone of having 50% of people living in San Francisco who are age 16 and up, everyone who is eligible, receive a first vaccination. And as of now, we're at 53%. That puts us ahead relative to the state. It puts us ahead relative to the rest of the country. So we're doing well. And when it comes to those who are 65 and older, the rates are even better. They're north of 80%. So that is really good news. Those are the populations in that age group that are more likely to get very ill or die if they become infected with COVID. So the vaccinations are a good thing, but we still don't have the supply that we need. We can administer 20,000 vaccinations per day in San Francisco, and we are not receiving nearly enough to be able to do that. And so we are going to need to get a lot more vaccine to people in San Francisco in order to feel confident that we can fully open up at full capacity, but we are getting there. Next slide, please. So with that in mind, with all of that framing in mind, let's talk through what some of the changes are. And one of the big announcements that has come out from the state and also from Mayor Breed just today is that venues, large venues that do events and professional sports with live audiences indoors can open. So this, for example, includes both seeing a Warriors game, going to a concert, and indoor graduation ceremonies. So this is a dense slide, but I wanted to just touch on a few areas. And that is one of those is that capacity is up to 35%. And there are testing and vaccination requirements to fulfill that larger capacity of 35%. But for relatively smaller events that are going to be only 15% capacity, up to 200 people maximum, whichever is fewer, that those will not require the testing or vaccination. And there are some other requirements that are in place, including distancing between households and masking as well right now, and being very cautious about food and drink and not mingling with masks down or off. So that is a really exciting development. We know people are very eager to be able to get back to doing some of those activities included in this category that people enjoy and have missed for over a year. Next slide, please. And so outdoors, we also have professional events, sports, live audiences, and performances. And examples of that are the Giants playing at Oracle Park, and concerts, outdoor graduation events. And the capacity there in expanded orange tier will be 50%. Advanced approval for both indoor and outdoor with a plan to the health officer is required for the larger of these events. And then again, physical distancing has to be in place. And again, we are going to have a requirement for testing or for proof of vaccination that would be needed for the larger of these events. And if the event is less than a number of 4,000, they must wear face coverings at all times and no food or beverage is served, then the testing or vaccination requirement is not needed. And next slide, please. Another new area that the state has announced as of last Friday and that we are also going to expand into is an area that has not really been able to operate since the pandemic, which is meetings and receptions, these private gatherings indoors and outdoors. So indoors, again, we're going to have decreased capacity relative to outdoors. That same framing that outdoors is safer because of the natural ventilation of being outside. So indoors, it would be up to 150 guests or individuals with face coverings and distancing. And everyone would need to provide proof of testing or vaccination to do that. So these categories include having purchased tickets or having a defined guest list, having a seating chart or assigned seating. So there are very specific definitions of what this looks like. And any food or beverage would have to follow the rules for indoor dining. And there are some other rules, again, designed to limit mixing between these groups that might be occurring simultaneously in a larger facility. For outdoors, it is possible to have up to 100 guests with face coverings, except for food and beverage service, which would follow outdoor dining rules, and distancing between different households. And testing would not be required up to 100 guests. In total, people could go up to as high as 300 guests with proof of vaccination or a negative COVID-19 test as well. So I'm sorry if I misstated this. Up to 100 guests, you do not need to do the testing and vaccination outdoors, but beyond 100, up to 300, you would. And again, the goal is to limit mixing between groups, to limit the time that people might have their masks down, and to be able to do this very safely with masking, whether it's indoors or outdoors. Next slide, please. So in terms of arts and music and theater performance and festivals outdoors, there is a 50-person cap. This is a state guideline that exists for the orange tier. And groups can eat together, but it would be no more than 8 individuals at a time. The groups of 8, up to 8, have to be separated by 6 feet. Everyone who attends has to be an in-state resident. And it's possible, though, that an arts festival or similar event could decide to use a reservation and assigned seating system and follow the larger capacity that we just talked about for live outdoor performances or private receptions or meetings. Next slide, please. Gatherings are another area where the state has released updated guidance, and we're planning to as well. So gatherings are more informal social gatherings. There's not necessarily a seating chart or an assigned guest list ahead of time or tickets. And for outdoors, without food, the maximum will be 50 people. Face coverings are required, and it's strongly recommended that people maintain 6 feet of distance between households. With food, it would be no more than 25 people. Face coverings should be removed only if eating or drinking. And again, trying to maintain distance between households as well, even though we're outdoors. Next slide, please. Indoors, small gatherings at up to 25% capacity for the room and no more than 25 people total with face coverings on, so no food or beverages, and distancing and ventilation measures are urged. The gatherings, though, even though they are permitted, are discouraged at this time. If people can have their gatherings outdoors, it is much preferred. And, you know, we know that the CDC has come out with recommendations for fully vaccinated individuals, allowing them to meet in small private gatherings with either other vaccinated, fully vaccinated households or people from one household that might be unvaccinated, as long as everyone in that household is at low risk, is not someone at high risk for severe illness or death from COVID-19. The state has not yet adopted the CDC guidance. However, in San Francisco, we agree that that is a safe way to interact for fully vaccinated people. And so we agree with the CDC, and we are awaiting the state to change its limitation on that particular piece of the guidance. And you see that on the right hand of the slide here. Next slide, please. So for hotels and other lodging facilities, as we just spoke about with meetings and conferences, limited size related to those rules are allowed per the safety rules that we just talked about, as detailed on slide 9. The hotels must furnish personnel who clean the guest rooms with a well-fitted mask. And San Francisco urges compliance with the state travel advisory and CDC travel guidelines. Next slide, please. For funerals and weddings, limited size receptions before and after events are allowed per the general safety rules for receptions and private events. Next slide. When dining outdoors, tables are now permitted up to 8 people total per table. Group reservations are allowed outdoors only for groups of up to 25 people. And the prohibition that we'd had previously on mingling between patrons at the group's tables is lifted. However, I will again encourage people to please keep their face coverings on to the extent possible, and to try not to keep them removed for the duration of their visit to a restaurant or other facility where they could be dining in these larger groups. Group reservations could include any table configuration, for example, 3 tables of 6 and 1 table of 7, 3 tables of 8, etc. Next slide, please. For dining indoors, the 11 p.m. Closure requirement is now lifted, and now tabletop cooking by staff of the restaurant is allowed. Next slide, please. For outdoor bars, they're open, again, outdoors only in Orange with table service and no more than 8 people per table, following the same safety protocols that apply to outdoor dining, except there's not a requirement to serve a meal. Group reservations are allowed per the safety rules we just talked about for outdoor dining. Next slide, please. For retail and grocery stores, we're removing the recommendation of special hours for unvaccinated older adults and others who are unvaccinated with chronic conditions. And bulk item bins continue to be allowed per safety protocols, using face coverings and hand hygiene requirements for patrons, but there no longer have to be special signage requirements for the businesses. Next slide, please. For zoos, aquariums, and museums, they can have auditoriums open for live performances in accordance with the capacity limits and safety protocols for indoor performances with live audiences. Next slide, please. For recreation, outdoor and indoor, for outdoor, organized and supervised leagues or clubs with stable groups can have up to 50 participants now on each team. That doesn't include the coaches and the staff. Outdoor swimming pools are open with distancing requirements between swimmers of different households, and spectators are allowed consistent with the rules for outdoor gatherings to the extent that the state rules allow. Indoors, organized and supervised adult leagues or clubs with stable groups can have up to 25 participants on each team. Youth and adults, however, who participate in an indoor high contact sport may not participate in any other sports program. But youth and adults who participate in other sports are not limited in the number of sports programs they participate in, but are urged to participate in no more than 2. We're trying to, again, limit the number of groups where people may have contact to try and reduce transmission. Spectators are allowed consistent with the rules for indoor gatherings, again, to the extent that the state rules allow. Next slide, please. So for other activities such as indoor family entertainment centers, we're not adding any additional types of indoor family entertainment that those are not allowed further in orange. Capacity for those that are already allowed to open may increase to up to 50% if all the personnel and patrons aged 12 and up provide proof that they're either fully vaccinated or that they have a COVID-19 test, with the specifics of the testing plan approved by my office. Open air boat operators and open air tour bus operators we've lifted the 25 person limit on groups of passengers. Indoor areas are open with face coverings and distancing at all times, and ventilation measures are strongly encouraged. For drive-in events like drive-in movies or drive-in performances, more than 1 household per vehicle is allowed, consistent with our rules for indoor small gathering that we just went over. And adult daycare programs and senior community hubs are allowed at up to 25% capacity indoors based on the participants, and no more than 25 people total with face coverings on, so no food or beverage service for now. And distancing and ventilation measures are urged, consistent with the same safety rules, again, that apply to small indoor gatherings. Next slide, please. So I want to thank you. I know it's been such a long year for all of you, for your industries and your business. I have really benefited from being able to hear from you, get input. I know that these restrictions are really difficult on how you operate. And as Director Topier said, I just really want to commend you for being exemplars of how businesses can operate safely during the pandemic, and how you have been such pillars of the community in keeping yourself safe, your staff safe, and your customers and clients safe as well, and contributing to the success that we have had in San Francisco. So I want to really urge your continued partnership. And these next weeks, as we are saying, are going to be really, really critical. So in a moment, you're going to be hearing from some of my other city colleagues who work with us on the compliance end of things. And before we hear details from them, I really just want to emphasize that compliance with our health orders is so critical at this point in time. It really will be the difference between us moving forward and having to continue to stay paused in orange, or what we really hope doesn't happen is have to roll back some of the things that we have planned, but we will have to follow the data. But our ability to turn those curves down is in all of our hands. We are going to be very, very serious about enforcing compliance, including thinking very broadly about all permits that the city issues that businesses might either hold or want to apply for, and taking into consideration violations of the health order when it comes to that. Notices of violation will continue to be served to the businesses and potentially also to landlords. We will also look at citations and fines and other ways in which we can do this, including closing businesses. We don't want any of that to happen. We know that the vast majority of businesses are doing everything that they can to keep folks safe. And so we look forward to a productive, continued relationship working together with you. Thank you again. I'll turn it back over to Director Topier.
Again, Dr. Phillip, for all of those updates and for the incredible leadership and responsiveness you've shown throughout this role. OEWD has received many questions from businesses about how the city is moving, monitoring and enforcing compliance. And we wanted to give you a clear understanding from the 2 teams involved in compliance. We will start with Maggie Weiland, who can offer an update on the role of the Community Education Response Team. Welcome, Maggie.
Thank you so much, Director Topier. Good afternoon. My name is Maggie Weiland, and I'm the Director of the Entertainment Commission. I'm excited to be here with all of you today after hearing more positive reopening news from Dr. Phillip as it pertains to the nightlife and entertainment sector here in San Francisco. As some of you may know, the Entertainment Commission has been leading the Community Education and Response Team, or CERT, during the pandemic. Our team was made up of disaster service workers deployed from a number of city agencies, including our own sound inspectors, in order to perform outreach and education for business owners in San Francisco as permitted activities reopened and the health order evolved. In the last few days, CERT began to descale its health order compliance operations in the evenings and on weekends. All health order compliance for food establishments will be overseen directly by DPH, who you'll be hearing from in a moment, the director of the Environmental Health Branch, Patrick Fosdale. So as we move forward, CERT will continue to support COVID compliance and education efforts just within a smaller scope. So this will include educating businesses like gyms and fitness centers, hair and nail salons, auto shops, offices, hotels, laundromats, retail, and more. And with entertainment and live performance activities continuing to come back online, our Entertainment Commission is going to refocus our compliance efforts in order to respond to entertainment and amplified sound complaints, which are increasing, as one might imagine, since we have a lot of outdoor sound sources being used right now in our shared spaces. Our inspectors are really looking forward to getting back out there and connecting with all of our permit holders as you begin to reopen your businesses and bring them back online. Finally, our office is here to support our permit holders as we navigate these new health order rules. So look out for resources from our office in the coming days. And in the meantime, to learn more about the Entertainment Commission and the work that we do, as well as our free outdoor Just Add Music or Jam permit being offered during the emergency, please visit sf.gov/Entertainment Commission. Thank you all again so much for joining today, and thank you to my fellow colleagues for having me. Back to you, Director Topier.
Thank you, Director Weiland. Now I would like to ask Patrick Fosdale from the Department of Public Health to give us an update on the city's compliance efforts. Director Fosdale.
Thank you, Director Topier. Good evening. My name is Patrick Fosdale. I'm the Acting Director of the Department of Public Health's Environmental Health Branch. Just by way of background, the Environmental Health Branch is a regulatory branch for the Health Department, and it's made up of about 30 different regulatory programs which enforce the nearly 50 different health codes in San Francisco. When the COVID emergency was declared, we added the enforcement of the health orders and directives to the work we were already doing. Next slide, please. When the health orders first began to be issued, which has now been more than a year ago, we recognized that complying with health orders was very new to our business community, and there was going to be a certain level of confusion. We also recognized that there are two main pillars to health order compliance. Those are prevention and enforcement. There's an old doctor saying that says, an ounce of prevention is worth a pound of cure. This also applies to health order compliance. The better job we can do at preventing violations from occurring, the better the compliance with the health orders was going to be, continues to be. To address this, the city initially formed the Community Education Response Team, or CERT, whose primary role was to educate and provide needed PPE to the business community, which Director Weiland just described. In addition, the Environmental Health Branch has also been open and operational throughout the pandemic. We've worked very closely with all the essential businesses that have remained open, like restaurants, grocery stores, single resident occupancy, hotels, etc. This has also included partnering with the Office of Small Business and the Office of Economic Workforce Development, like we're doing this evening, in order to provide assistance to the business community. We've sent out email blasts to our permitted businesses, provided guidance documents around compliance, sent out staff to conduct thousands of compliance checks, and participated in webinars like the one today. All that is an effort to try to avoid having to go heavy-handed on enforcement. You can see the enforcement tools listed there, and we can continue to work closely with the City Attorney's Office around when and how these are used. The City Attorney's Office has also held the property owners of non-compliant businesses accountable for their tenants' actions. Dr. Phillip mentioned that. So if you are a property owner, it is in your best interest to stay on top of your tenants and their compliance with the health orders. At the end of the day, these enforcement tools are applied when prevention fails. The way the health orders are written is that they include penalties, including fines and jail time. Up to this point, we have primarily used notices of violation and facility closures to gain compliance. The health orders allow for closures up to 2 weeks or until the next tier, so it can be a significant loss to the business. Fines can also be significant, and we'd like to avoid imposing those, but we are prepared to issue them for egregious violators. In addition, as the city continues to reopen, as Maggie said, the Entertainment Commission will now be responding to their permitted entertainment events, and DPH will be focused on the food and bar establishments. So between the two programs, we will continue to have a substantial presence after hours and on the weekends. So please don't be fooled into thinking that the health orders are enforced or aren't enforced after hours. Along these lines, it is worth noting that the businesses violating the health orders are also putting their other permits at risk, including those issued by the Alcoholic Beverage Control, or ABC, the Entertainment Commission, and shared spaces. Some of these are very difficult permits to obtain, so that's just a word of caution to the business community. Next slide, please. Up to this point, DPH has performed around 7,000 compliance inspections, and we've issued citations to around 1,700 businesses, or roughly 24% of those inspected. So there's been a fairly high rate of businesses complying with the health orders, and this is something we'd like to see continued as we reopen. You can see listed there some of the most common violations, and we are currently issuing around 2 closure notices to businesses each week. Next slide, please. As we look at the future and the modified changes under the current orange tier, we do have some concerns based on what we've been seeing in the field. As Dr. Phillip has pointed out, our biggest concern regarding the spread of COVID is overcrowding indoors. We have seen this primarily at entertainment venues and at bars and restaurants. We've also seen this happen at gyms and churches, so this risky activity can happen anywhere. If you're currently operating a business which has the potential for large indoor gatherings, which could exceed the limits Dr. Phillips just outlined, we're asking that you spend some extra time putting in place adequate security and safety measures in order to ensure the safety of your customers and employees. Please keep in mind that we will continue to have inspectors in the field after hours and on the weekends, and we will continue to document violations and take enforcement action when necessary. In closing, from time to time, I get asked about how San Francisco continues to have such impressive statistics when it comes to COVID, as it has been held up nationally as an example of a large city that has done it right. And I think there are a variety of factors that have contributed to these results. One of those was the tremendous amount of time and effort that has gone into that ounce of prevention I spoke about earlier. And the open channels of communication between local government and the business community has been outstanding and contributed to the great partnership that currently exists. From the beginning, we have recognized that there was going to be a limit to the amount of compliance we could achieve through enforcement alone, and that long-term compliance, especially we've been at this for a year now, was going to happen only when we had buy-in from our business community and by forming that partnership. As Dr. Phillip mentioned, we are still in a race that has pitted the vaccine rollout against the virus. Right now, there is reason to be hopeful that we will win, but we need to continue to be vigilant and put ourselves in the best possible position to win that race. If we can continue to do what has gotten us this far for just a while longer, we will be able to reopen safely. Having said that, as Dr. Phillip also pointed out, we are not out of the woods yet, and caution is still warranted. As we continue to monitor the numbers, as the city continues to reopen, we're beginning to see an increase in disease transmission. This is no time for complacency, and we're asking you to redouble your efforts in order to ensure that the health and safety of your employees and customers is continued. With that, I'm going to turn it back over to Director Topier.
Thank you, Director Fosdahl. We really appreciate you presenting today and for your thoughts and comments on how we can continue to comply. At this point, we will turn it over to you, our viewers, to ask your questions. Please send your questions to Q&A through the chat function, and we will try to get through as many of them as we can. If we do not answer your question today, please email them to marianne.thompson@sfgov.org. And if you are a member of the press, please send your inquiries to dempress@sfgov.org. In addition to questions you may have about the health guidelines and activities, we have also asked a few of our city's leaders to join us today in case there are other questions about supporting programs, including OEWD's Diana Ponce de Leon, who can speak to resources and support available to businesses, and Robin Abad, who is the director of the Shared Spaces program, who can speak to any questions about our shared spaces. So I will start reading off some of the questions. It looks like we're getting quite a few, so I appreciate that. Starting with for Dr. Phillip. For services that are open now, can spas move their waiting areas indoors to waiting rooms right away? Is there any expectation for when steam and sauna can also reopen?
Thank you for those questions. The saunas and the steam rooms are not able to open in orange tier, so I think that's a fairly straightforward question. And in terms of waiting areas, I think that should be allowed with spacing. But if I'm understanding the question correctly, so we may need to take your question offline and make sure we're answering that specifically.
Thank you. The next question is about short-term rentals and when will they be allowed in the yellow tier? And the question is asking why they are restricted when hotels are not.
Thank you. And this is a question that we have been getting quite a lot. So we know that there is a lot of interest in short-term rentals and why they are not operating currently. This is within the state system. This is not allowed under the state guidance, which again, in San Francisco and in every other county, we must adhere. When the state says that something is prohibited under their health order, we are required to be at least as strict as the state is. We can be more strict in certain circumstances if it's warranted. So the state is currently prohibiting short-term rentals where the owner is present. It can happen in unoccupied rentals. It can happen in a rental where the guest is entirely in a separate part of the house and has a separate entrance and exit and uses separate facilities. But otherwise, it is not permitted yet by the state.
Thank you. This one, for meetings and receptions, does this include private events at restaurants?
The guidance for indoor small meetings and receptions does include private events at restaurants, following all of the requirements, including all the health and safety requirements that we just talked about. So it would potentially include that.
Okay. Do these updated orange tier guidelines take effect immediately or not until April 15th? And I love the way this is phrased. And there's no chance of moving to yellow tier next week?
I am as disappointed as this questioner is that we are not moving to yellow tier next week, because we were on such a roll, weren't we? We went from purple to red to orange, and we were just going as quickly as we could, as fast as the state would allow it per its rules, we were doing it. And I think we will get there, but we don't know exactly when it will be. And I do want to say that, as we've been able to open as much as we have, we knew that all of us were coming into more contact with each other. And that's a good thing. We want businesses and activities and recreation to all open up, and that cases would increase a little bit. So this is not necessarily unexpected, but we do have to be cautious and make sure it's not a sign of a trend of increasing again. So no, there's no chance that we're going to be able to go next week. And for the timing of the changes I just talked about, it will be on the 15th when the state allows these events that we just talked about to happen, the indoor performances and the gatherings and the private events as well.
I have a question about travel quarantine. Could you clarify the current travel restrictions, and do you require a 10-day quarantine?
So San Francisco no longer requires a mandatory quarantine. We lifted that travel order a while back. And the state currently, no longer has a rule that it used to have, an order or a recommendation, an advisory, I should say. Wasn't an order, it was an advisory to say that you should limit your travel to within 120 miles. They're still strongly urging people to avoid unnecessary travel, and we say that as well. And people who travel outside of the state, it's recommended that people voluntarily quarantine when they return, and that they also test to make sure that they're not infected, except for people who have been vaccinated. That's one area in which vaccination means that you no longer have to quarantine or test with travel. And the CDC has those recommendations as well.
This is a question of looking for clarification. Hotel room attendants are no longer required to wear non-vented N95 masks. Is that correct?
This was a rule that we had previously, and it has changed as vaccination has been made available to people who do cleaning of all types, including hotel rooms. They've been prioritized in our prior vaccination waves. And we do want to make sure that those masks are available to people if they would like them. But because of vaccination, it is no longer mandatory.
There's a question asked for clarification on indoor performances. Are the number of performers included in the total number of people allowed in the venue?
The capacities are for the people who are attending the venue.
I think this I think is for Director Fosdal. It's a process. To receive approval for the safety and health plan.
Yeah. So the health and safety plans that Dr. Phillip mentioned during her presentation, those would come to us. Example of that would be, I think it was mentioned, the Giants ballpark. That's a safety plan that needs to be submitted in advance. We review it and approve it. And so that comes to our office.
Thank you. I do have a question for Robin Abad. How is it looking for parklets to remain beyond the June 30th, 2021 date?
Thank you, Director Topier. Hi, everyone. Robin Abad, Director of the Shared Spaces Program. Yes, we know that this is a thought on everyone's mind. Currently, departments are preparing to communications with everyone who operates a shared space about a permit extension. So please stay tuned for more information and details about that. The city remains committed to helping everyone continue operating safely outdoors, and for our small businesses to keep up with their recovery and to keep thriving. So more details should be forthcoming soon.
Thank you, Robin. Back to Dr. Phillip. I think this is a clarification. So why do outdoor meetings have smaller capacity than indoor? I think that's just the first part. So I think asking 150 indoor versus 100 outdoor.
Well, it's 100 outdoor where you don't have to do any testing. So that's the difference, right? It's 150 and people do have to test. But outdoors, you have an option for not testing if you have a smaller group. You could go up to 300, but then you do have to do the testing.
And then another question regarding museums and other organizations that defray operating expenses by renting their spaces for meetings, etc. Rentals have been on hold. Do these new rules mean that we can begin to rent again? And if so, is there reference about what requirements the host site must meet, as well as requirements for renters?
Yes, thank you. Those would be allowed, but both the renter and the host are responsible for complying with the requirements of the health order for the meeting. And so, the specifics of all of these are going to be coming out in the health order, so you will be able to see those. And what we would require is following that, both for the people using the space and the actual the venue itself for the operators and owners of that venue.
This is a question, I'm not sure, I think, so this is a question about appointments available at Moscone. It says that SF COVID is sending San Francisco, Oakland, and other faraway Bay Area cities.
Oh, I think this question is about getting vaccine appointments. And, you know, thank you for raising this. It is not directly related to reopening, but it is in the sense, right, that we want everyone to be able to get vaccinated. And I think what you're experiencing, or what I heard you describing, was being sent to other areas when you try to sign up for vaccine. Our Moscone site is connected to the system that provides access to vaccine across the state. It's called My Turn. And unfortunately, again, because of the limitations that every county is experiencing, it might be that there's not a vaccine that's available for us in San Francisco that day, but it does exist at the Coliseum site in Alameda, for instance. And so it will show you that availability to see if you'd like to go there. We want to get to the point that anyone is able to log on and see multiple sites in San Francisco, their pharmacy, a mass vaccination site. And if people work or live in a priority communities that have been hardest hit, there'll be other options there as well. So again, as our supply increases, you will see more options open to you when you start looking for places to get vaccine.
And thank you. I have one last question for you, Dr. Phillip, and it's also related to vaccine. If staff who work with seniors, youth, and children are fully vaccinated, do we still need to require COVID-19 testing? We do not know if our clients are all vaccinated. Are there written guidance from DPH on COVID-19 testing after full vaccination?
Thank you. We are working on those questions right now. You know, testing has been the mainstay of how we've tried to keep people safer when they're interacting together, and it continues to be important as we're ramping up vaccine. But we don't yet have guidance on a national level, a state level, and we're working as well locally to try to sort through what does it mean if people are fully vaccinated, what can they do, what can't they do. So stay tuned. I suspect that might be a webinar in and of itself at a future date, but more information to come.
Thank you so much. And we are at time. So before I close, I want to thank all of our participants that presented today, as well as just for your availability to help us answer questions as well. And as also, as a reminder, if we did not get to your questions, please visit our website, oewd.org, or email marianne.thompson@sfgov.org. We really appreciate all of you joining us today, and we look forward to reopening together soon. Thank you.
Thank you, Director Topier. Just something we'd like to share with the group. The Together We Heal campaign was born to protect the African-American community and their unsung heroes from COVID-19. This campaign is the brainchild of the San Francisco African-American Arts and Cultural District